I'm a neurologist. I specialize in movement disorders. There's the Parkinson's disease and neurodegenerative patients who are usually older than age 60. And then there's patients with conditions like functional movement disorder or various types of tremors who are typically younger, in the age of 30 or 40 or older. Patients present with slowness, stiffness, difficulty walking, sometimes falls, of course, tremor, and a variety of other neurological symptoms such as weakness, sometimes difficulty speaking or memory problems. The field of Parkinson's disease alone has had many breakthroughs over the last few years, and a lot of oral medications that come alongside that and the difficulty of managing them together and cross interactions. Then there are procedures. Some patients may need Botox injection for stiffness, and more advanced procedures like MRI-guided focused ultrasound and deep brain stimulation surgery for cases where medications are not enough. I'm involved in surgeries. There's a neurosurgeon who does the bulk of the operation, but during the surgery we have patients awake and we need to examine them and make sure that we're on the right target and getting good benefits, and that's where neurologists like myself fit in. This is a patient population where there's often very difficulty in making the diagnosis, let alone providing treatment. So being able to help them in that process after they've sometimes been seeking multiple opinions and working them through that is very rewarding. These days I have they were recently 3 under 3, young 2 twins and a toddler. So most of the time is spent with them.